In today's video, we'll be discussing a critical topic, Alzheimer's disease. Join us as we explore the 10 warning signs that could indicate the presence of this condition, and learn why early detection is crucial for managing the disease effectively. Did you know that Alzheimer's disease is the most common form of dementia, accounting for approximately 60 to 80% of all dementia cases? According to the Alzheimer's Association, an estimated 6.7 million Americans aged 65 and older are living with Alzheimer's. Approximately 1 in 9 individuals aged 65 and older has Alzheimer's disease. The World Health Organization reports that approximately 55 million people worldwide are living with dementia, with the majority of these cases attributed to Alzheimer's disease. Recognizing the early signs and symptoms is crucial for timely intervention. So, let's begin. Alzheimer's disease is a progressive neurodegenerative disorder that affects the brain. It is characterized by the accumulation of abnormal protein deposits in the brain, leading to the progressive loss of brain cells. Alzheimer's impairs memory, thinking, and behavior, gradually interfering with a person's ability to carry out daily activities. As the disease progresses, it can have a profound impact on an individual's quality of life and the lives of their loved ones. Most of us are familiar with the classic symptoms of Alzheimer's, such as memory loss and confusion. However, there are several other signs that could indicate the presence of the disease. Let's explore these symptoms in more detail to raise awareness and help you recognize them if you or a loved one might be affected. 1. Memory loss. The most common early sign of Alzheimer's disease is memory loss. Individuals may have difficulty remembering recently learned information, important dates, or events. They may rely heavily on memory aids or family members to recall things. 2. Difficulty with problem solving. Alzheimer's can impact a person's ability to solve problems or make plans. Simple tasks, like following a recipe or balancing a checkbook, may become increasingly challenging. 3. Confusion with time and place. Individuals with Alzheimer's may lose track of time, dates, and seasons. They may also have trouble understanding where they are or how they got there, even in familiar surroundings. 4. Challenges with language. People with Alzheimer's often struggle to find the right words or follow a conversation. They may repeat themselves or have difficulty expressing their thoughts clearly. 5. Poor judgment. Alzheimer's can affect an individual's decision-making abilities. They may exhibit poor judgment, making uncharacteristic or risky choices in their personal or financial matters. 6. Withdrawal from social activities. Individuals with Alzheimer's may gradually withdraw from hobbies, social activities, or work projects. They may feel overwhelmed by the cognitive demands and prefer to avoid situations that highlight their difficulties. 7. Mood and personality changes. Alzheimer's can cause significant mood swings, ranging from confusion and depression to irritability and aggression. Personality changes, such as becoming suspicious or fearful, can also occur. 8. Misplacing items. A common symptom of Alzheimer's is misplacing everyday items and struggling to retrace steps to find them. This may result in accusations of theft or paranoia. 9. Challenges with visual perception. Some individuals with Alzheimer's may experience difficulties with visual perception, making it hard to judge distances or identify objects. This can lead to problems with driving or reading. 10. Difficulty with self-care. As the disease progresses, individuals with Alzheimer's may struggle with basic self-care tasks, such as bathing, dressing, or grooming. They may require assistance or reminders to maintain their hygiene. It's crucial to seek medical attention promptly if you or a loved one experiences any of these symptoms. Early detection and intervention can lead to better management of the disease and improved quality of life. If you found this information valuable, don't forget to hit the like button and subscribe to our channel for more informative content on various health topics. The exact cause of Alzheimer's disease is still not fully understood. However, there is evidence to suggest that a combination of genetic, lifestyle, and environmental factors contribute to its development. Let's discuss some of the primary causes that researchers have identified. Age. The greatest risk factor for Alzheimer's disease is advancing age. The risk increases significantly after the age of 65, and the likelihood of developing the disease doubles approximately every 5 years thereafter. Genetics. Genetic factors play a role in Alzheimer's disease. Mutations in certain genes, such as the APOE1 and PCN2 genes, can increase the risk of developing the condition. However, it's important to note that having these gene mutations does not guarantee the development of Alzheimer's. Family history. Individuals who have a first-degree relative, such as a parent or sibling, with Alzheimer's disease, are at a slightly higher risk compared to those without a family history of the condition. Down syndrome. People with Down syndrome have an increased likelihood of developing Alzheimer's disease, usually at an earlier age than the general population. Gender. Women tend to be at a slightly higher risk of developing Alzheimer's disease compared to men. However, this may be partly due to the fact that women generally live longer. Apart from these primary causes, certain health conditions and lifestyle choices can also influence the risk of developing Alzheimer's disease. Let's explore these connections. Cardiovascular health. Poor cardiovascular health, including conditions like high blood pressure, high cholesterol, and diabetes, can increase the risk of developing Alzheimer's disease. Taking care of your heart health is crucial for maintaining brain health as well. Physical inactivity. Leading a sedentary lifestyle and lack of regular physical activity have been associated with a higher risk of Alzheimer's disease. Engaging in regular exercise can promote brain health and reduce the risk. Smoking and alcohol consumption. Smoking and excessive alcohol consumption have been linked to an increased risk of Alzheimer's disease. Quitting smoking and moderating alcohol intake can help protect brain health. Obesity and poor diet. Obesity and a diet high in saturated fats and processed foods may increase the risk of developing Alzheimer's disease. Maintaining a healthy weight and following a balanced diet rich in fruits, vegetables, whole grains, and lean proteins is beneficial for overall health, including brain health. Cognitive stimulation. Engaging in mentally stimulating activities, such as reading, puzzles, learning new skills, and social interactions, can help maintain cognitive function and reduce the risk of cognitive decline. If you or a loved one is experiencing symptoms that could indicate Alzheimer's disease, it's important to consult a healthcare professional for a proper diagnosis. The diagnostic process may involve detailed medical history and physical examination, cognitive tests and assessments, blood tests to rule out other possible causes of symptoms, brain imaging techniques such as MRI or PET scans to visualize changes in the brain. While there is currently no cure for Alzheimer's disease, various management strategies and treatments can help improve symptoms and quality of life. These may include medications to manage cognitive symptoms and slow down disease progression, cognitive and behavioral therapies to enhance coping skills and manage behavioral changes, supportive care to address the individual's physical, emotional, and social needs, lifestyle modifications, such as a healthy diet, regular exercise, and social engagement to support overall brain health. It's crucial to recognize that Alzheimer's disease can have silent or less recognizable symptoms, especially in the early stages. This often leads to delayed diagnosis and missed opportunities for early intervention. Let's shed light on some of these manifestations. Mild cognitive impairment. Mild cognitive impairment, MCI, is often an early stage of Alzheimer's disease. It involves noticeable cognitive changes that are greater than expected for age but do not interfere significantly with daily functioning. MCI can progress to Alzheimer's disease over time. Sundowning. Sundowning refers to the worsening of symptoms, such as confusion and agitation, in the late afternoon or evening. It's a common occurrence in Alzheimer's patients and can be challenging for both the individual and their caregivers. Alzheimer's disease not only affects individuals diagnosed with the condition but also places significant strain on their caregivers. The emotional, physical, and financial toll can be overwhelming. Support for caregivers is essential. Untreated symptoms of Alzheimer's disease can have serious implications for long-term health. Let's discuss some of the potential consequences. Decline in cognitive function. Alzheimer's disease is characterized by a progressive decline in cognitive function. As the disease progresses, individuals may experience worsening memory loss, difficulty with language, in communication, impaired judgment, and problems with problem-solving and decision-making. Loss of independence. Alzheimer's disease affects cognitive abilities and daily functioning. Individuals may become increasingly dependent on others for their care. They may require assistance with activities of daily living, such as bathing, dressing, and eating. Increased risk of accidents. Alzheimer's disease can increase the risk of accidents and injuries. Individuals may have difficulty navigating their surroundings, which can lead to falls or other accidents. They may also forget to turn off appliances or engage in unsafe behaviors. Emotional and psychological impact. Alzheimer's disease can have a profound emotional and psychological impact on individuals and their loved ones. Individuals with Alzheimer's may experience frustration, confusion, and depression. Family members and caregivers may experience stress, grief, and feelings of loss as they witness the decline of their loved one. Social isolation. Due to the cognitive and behavioral changes associated with Alzheimer's disease, individuals may withdraw from social activities and relationships. They may struggle to engage in conversations or participate in hobbies they once enjoyed, leading to social isolation and feelings of loneliness. Financial burden. Alzheimer's disease can place a significant financial burden on individuals and their families. The cost of medical care, medications, and caregiving services can be substantial. Additionally, individuals with Alzheimer's may have difficulty managing their finances, leading to financial challenges and vulnerability to scams or exploitation. Caregiver stress and burnout. Caregiving for someone with Alzheimer's disease can be emotionally and physically demanding. Caregivers may experience high levels of stress, exhaustion, and burnout. It's essential for caregivers to seek support and take care of their own well-being. Recognizing the signs of Alzheimer's disease is crucial for early detection and intervention. If you or a loved one is experiencing any of the symptoms we discussed or have concerns about cognitive function, it's important to consult a healthcare professional for a proper evaluation. Remember, early diagnosis allows for better management of the disease and access to support and resources that can improve quality of life for both individuals with Alzheimer's and their caregivers. Thank you for joining us today on Healthy Factors. If you found this information helpful, please give this video a thumbs up and share it with others who may benefit from it. Don't forget to subscribe to our channel for more valuable content on health-related topics. Take care, and we'll see you next time.